All right, hey everyone, this is Drew from Incredible Marketing. I'm at the IM3 booth at ASAPS 2017, joined by Dr. Krochmal from Chicago.
Hello.
Good to be here. Having a good show so far?
Absolutely.
Awesome.
Absolutely.
So,
learning a lot. The weather's beautiful outside. It's wonderful to be here from Chicago.
Cool. Real quick, any new things you've learned at this show that you're looking forward to taking back to your patients?
Yeah, there's been some incredible advancements in terms of non-invasive treatments for patients, in terms of non-invasive fat reduction and for skin tightening, and there's a lot of talk about the injectables and what we can do with that. So as much as I'm a surgeon, there are so many other options that I can offer my patients outside of the operating room.
Okay.
I'm really looking forward to that.
Sweet.
In terms of the surgery side, patient safety in terms of what we can do with buttock fat grafting and making the results fantastic and keeping our patients safe, that's something that I'm also looking forward to bringing back to the practice.
Great, cool. Well, while you just mentioned buttock fat grafting, let's segue. You have something called the C.R.A.F.T technique, right, that you've innovated yourself? I
have. Cellulite is a very common problem, and
Okay.
there's probably multiple kinds of cellulite caused by different things, and there's a particular type of cellulite in the buttocks that's more of the crater type or the dimple type, and it's caused by a dense band that runs from the skin all the way down to the underlying muscle. And
Okay.
we've tried things in the past to try to even out the buttocks in terms of just doing fat grafting or using energy devices to try to shrink the skin and smooth it out or deal with the fat, but the issue is the band. So the technique that I use uses a very tiny needle, and you can literally tease away at that band with that needle until it fully releases. So once you fully release that band, then you see the skin go from a deep crater down to a more shallow kind of a crater.
Okay.
I combine that with fat grafting
Okay.
to just fill in that little bit of a space and create a nice smooth effect. So I like to tell patients that I can take their buttock that looks like a golf ball and make it into more of a ping pong ball. And it's under local anesthesia. Since we do some liposuction for the fat grafting, we can do some liposuction and target some of the trouble areas of women and men.
Okay.
So you get the best
Sweet.
of both worlds. So you get a smoother buttocks and some body contouring as well.
Awesome.
So it still stands for cellulite rhigotomy.
Okay.
Rhigotomy is the fancy term for using that needle just to tease the band and release it.
Okay.
And fat transfer. C.R.A.F.T.
Gotcha.
C.R.A.F.T.
C.R.A.F.T.
So I'm very excited about it. Patients
now,
are happy.
is this exclusively at your practice right now?
It's something that we did develop.
Okay.
There are some variations on the theme around the country, but as far as I know, my particular technique, I'm the only one who's doing it currently, and I'm trying to spread the word because technically it's not that difficult to do.
Yeah.
So I think surgeons can adopt it, and patients are getting great results, so there's no reason why other people can't do it.
Awesome. Let me ask you about downtime. Is there any, how are results immediate? How long does it take? What's the recovery process like?
There's some bruising and there's some swelling.
Okay.
So typically for a couple days afterwards, people feel like you're a little sore.
Yeah.
And the bruising typically takes about 2 to 3 weeks to go away, but afterwards, patients can go back to work basically immediately afterwards. So I don't have any restrictions on patients afterwards. There's no lifting restrictions, there's no workout restrictions.
Okay.
After a couple of weeks, you can go ahead and you can start taking a bath, but I let patients shower immediately afterwards.
Okay.
So it's actually pretty easy to do.
Sweet. Golf balls to ping pong balls.
Golf balls to ping pong balls.
It's a great analogy. All right. Thanks, Dr. Krochmal. Everybody go check out the C.R.A.F.T technique and have a good rest of your show.
Thanks, Drew.
Thanks for joining us.
Thank you.
Take care.